They told you, with your personality, with your hair, with your hijab, with your skin color, with your preferences, with your gender. They told you, with their silence, with their words, with their resentment, with their absence. They told you, you don't belong. Yet, here you are.
Hello, my name is Amy Jones. I'm a fourth year medical student at the University of Nottingham, and I'm also the current president of the Nottingham Scrub Society.
Hello, my name is Tom Nieto. I'm an ST8 renal transplant trainee based in Manchester, and I'm the Herrick Society president, which represents UK transplant trainees.
Hi, my name's Ellie Priestman. I'm a fourth year medical student at Bristol University. I'm also the ACIT Equality and Diversity Ambassadors co-chair, as well as being the vice president at the Bristol Women in Surgery Society.
Hi, I'm Michael Okocha. I'm a general surgery registrar in the Southwest, and I'm the Association of Surgeons in Training Equality and Diversity Officer. I really hope you enjoy this episode of 50 Faces of Surgery. I hope that it leaves you feeling valued, inspired, and most importantly, welcome. Here I am.
Miss Anusha Edwards is one of the first Asian female consultant kidney transplant surgeons in the UK. Based in the Southwest, she graduated at the local Bristol Medical School and was appointed consultant in 2012. Miss Anusha Edwards is also the specialty lead for transplantation and a fellow of the Royal College of Surgeons of England, as well as being a member of the British Transplant Society and British Association of Endocrine and Thyroid Surgeons. Her passion for her work has led her to feature on many platforms, including the BMJ podcast, as well as BBC Points West, which discussed how people from Black and Asian ethnic backgrounds were more likely at risk to die in waiting for their kidney transplant than those from a white ethnic background. However, her latest interest, and something that she is incredibly passionate about, is the well-being in the workplace and creating a supportive network between colleagues on a background of her own experiences.
So, our first question for you is, can you please take us through your morning routine?
Yeah, sure. So I get woken up by one of three things, actually. Either my husband getting out of bed to go and exercise at some ridiculous hour, or my alarm clock if I can make it that late, or some birds having a sing off outside my room. And then I guess for me at the moment, it involves getting ready, getting out of the house. And at the moment, that involves taking my son to school and dropping him off on the way. And then starting whatever the day holds for me, whether that be operating list or clinic. And at some point in the morning, finding some time for myself to have some breakfast.
Fantastic, thank you. And so, where did you grow up?
I grew up in Kent. I was born and brought up in Kent. My family originally are from Sri Lanka, and my parents had lived here for some time before I was born, and went to school there, and then came to Bristol to university.
Thank you. And so, what was life like when you were growing up?
I have only happy memories of it, actually, really. I think I had a great childhood. My schooling was all pretty happy. Primary school was a mixed local school, went to an all-girls state secondary school. Everything was interesting, everything was exciting. Summer holidays went on for years and years. It was a great childhood, and then became inspired to do other things.
And one of those inspirations was obviously to become a doctor. Why did you apply for medicine?
I don't know. I really can't answer that question with any great honesty. I sometimes wonder whether it's because I enjoyed playing doctors and nurses as a child. Who knows? But for as long as I can remember, it's what I really wanted to do. And I think just the older I grew and the more understanding I had about how the body worked and just how amazing medicine is, the things that we can do, the science behind it, the more inspired I was to do it, really. And certainly looking back now, I can't think of anything else I'd rather do. I think if I lost my job as a doctor, I'm not sure quite what I would do.
And when you got to medical school, what was it like for you?
If you wanted the one word answer, I guess it would be fun. If you wanted something more than that, it was fun, it was hard work, it was challenging and stimulating. I don't think a day goes by at medical school where you don't learn something. And if it's not about medicine, it's about people or about the world around you. Constantly, thought-provoking, really. Great experience, loved it.
Wonderful. And what was your training like? Where did you do it?
So after medical school, I did my house jobs in a combination of Bristol and Bath, and then I did my basic surgical training in Bristol, and then I did a research degree between basic and higher surgical training. That was based at the vet school in Langford, and then my higher surgical training was all in the southwest as well. It was good. I think I always found it slightly challenging, changing jobs, changing hospital, meeting new staff, using new computer systems, that same thing that we all have for that first week where absolutely nothing is familiar except how to diagnose appendicitis or whatever. Everything is different. So I think that just kept you on your toes, really, I suppose, changing jobs every 6 months. Other than that, great training.
Wonderful. And your consultancy, what was the first week like for you?
A combination of slightly boring because my job plan hadn't been fully formalized, exciting to have finally got there, and slightly nerve-wracking. I did actually have an operating list in my first week, and I remember doing it with quite a senior anaesthetist who commended me for having booked a really sensible list as a first list. I think it had something like a lap chole, a hernia repair, and a PD catheter insertion or something. And at the end of it, we had the debrief, and he just said, that's a really good list to start as a consultant, really straightforward cases, well done. And I thought, yeah, really brilliant. And then the next morning I turn up and the registrar on call rings me and goes, oh, that woman you did a lap chole and yesterday, she's just been admitted on the take with obstructive jaundice. You go, oh no, disaster. I've clipped someone's common bile duct on my first list. Actually, she just passed a stone, but it's those moments, and I think that sort of defines one's consultant career, is that there are these moments of great satisfaction where you feel you've done the job well, or you finally achieve something, or you finally feel comfortable doing something, and then moments of fear where you fear that you've caused harm, which is one of the hard things as a consultant, because the buck stops with you then.
Have you faced along your journey?
I spent quite a lot of time thinking about this question, actually, Michael. I think I don't think I've particularly experienced any sexism or racism along the way. I think my biggest two challenges probably are, number one, juggling a family life with what is more than a work life, really. It is a life choice, isn't it, really? I've been very lucky to have a really supportive husband who has always been 100% behind me and always been able to help me out with childcare, and so that's the way I've got through that. I think the main challenge I have faced is that of bullying. When I started off as a consultant, in fact, probably in the final stages of my registrar training and starting off as a consultant, I was bullied by a consultant colleague, which I spent a lot of time thinking about, and I don't think it was really racism or sexism behind it. I think it was something slightly different, and that bullying went on for the first 3 or 4 years of my consultant life, which made settling down, feeling confident, feeling like I could do the job very difficult. I think when you've got someone who is actively going around telling you and people in the department that you're not trained, you're not competent, you don't know how to do the job, pointing out tiny little things that I wouldn't even bother mentioning to trainees about your work. It's really hard to sort of settle in and think, yeah, I've made it, I'm a consultant, I'm here, I can deal with this. So I think that was probably the biggest challenge, and hopefully the only big challenge I'll have to really face as a consultant.
So bullying has been quite a theme in our video series,
Yeah.
and for many trainees who go through it, they have no idea. How do you overcome that?
I think the practical side of overcoming it for me was to have it dealt with, and I guess practically the things that I did is I kept a diary of everything that happened. I kept notes, I kept emails about everything that happened when it was very clear in the early stages that it was not just going to be resolved. This wasn't just a personality thing. It was something that ran slightly deeper than that. And that allowed me towards the latter stages, when this became sort of more of a disciplinary event between the trust and that person, to actually just be able to hand them a sort of dossier of, this is what's gone on, this is your bullying policy, and this is what's gone on in complete breach of all of that. So I guess that's how I dealt with it from a practical perspective. And actually that person was decided to resign, I believe, the day before they were going to be fired by the trust. So and that for me was, I guess, the first step towards recovering and overcoming it. Lots of people talk about me having won. I'm not sure that it was a battle where there was a winner or a loser. I think there was just a bit of a maybe good at overcome evil in a kind of Marvel comic kind of way. But I think it was more that I survived. You have to really deal with that. You have to have some amazing support networks. You have to have people who are behind you. And you have to almost go down to the total basics of what you do. So do your job, go home, be a wife, be a mother. And really there wasn't much time or energy to do anything else. But with time, you learn to become more confident, you learn to make tougher decisions, you learn to juggle more things, and you become yourself, or the person you wanted to be, that you were sort of held down by. I think the other thing that really helped me is I had amazing support from the BMA. I had a fantastic advisor who stood by me the whole time, gave me amazing advice, and just really guided me through the whole process.
And has there been a kind of career defining moment for you? Maybe it was a moment that you were challenged, or maybe it was something that made you change your career path.
There are loads of those. Where do I start? I guess the moment I first saw a kidney transplant was probably the moment I knew I wanted to be a kidney transplant surgeon. I think there is something absolutely phenomenal about taking something from someone who is dead, essentially doing a bit of plumbing, giving it a blood supply, giving it a drainage, and then watching it come to life. And that blows my mind even now, as you'll know, Michael. I still, go on about this when I do that. And I think I'm watching that the first time and just going, that's amazing. We've taken something from someone who's died, we've given it a blood supply, and we've brought it to life. And oh my goodness, it's making urine. How do we do that? That's phenomenal. So I think that was probably the first time I really thought, oh, transplantation, because as a medical student, like so many of the UK medical students in this country, I'd had no experience of transplantation whatsoever. So to be fortunate enough to have done a house job where I got to see it was probably the turning point for me in terms of deciding I wanted to do transplantation.
It's amazing to hear your experience of how you got into transplant. I can echo those sentiments. I still find it amazing seeing it every day, and yeah, I switched my career aspirations because of that. So it's great to hear a similar story.
Yeah.
So if I could ask, if you could go back in time,
yeah,
what would you say to yourself to inspire or motivate you?
I think I would probably just go, it's worth it in the end. It is a phenomenal job. As I said before, I couldn't think of anything I'd rather do, and I don't think I would choose any different career path. I don't look at other specialties and think, wow, I wish I was doing that. So I think just stick at it, to make the most of every opportunity that comes your way. Be enthusiastic, ask the questions, stay late, and you can make it.
And have you got any advice for medical students, and especially aspiring surgeons, that you could give?
Yeah, I think probably just to have a belief in yourself that you can do. We see lots of medical students and sort of F1s who come in and sort of say, yeah, well, I think surgery will be too hard for me. But then you watch them close the skin, you think, well, actually, you have a great pair of hands. You could do this. And sometimes it's just that someone has said something to them that has put them off. And it might be some flippant comment that someone saw them, I don't know, carve the Sunday roast and said, don't become a surgeon, will you? And they've sort of taken it to heart. Or it might be that they saw a surgical consultant moaning about their work-life balance. But actually, I think it is a great specialty. So if you have even the slightest bit of interest, be keen, be enthusiastic, ask the questions, find yourself someone who inspires you. I worked at a time where actually the consultant who I worked for was also the person I did my own calls with, and so got to know them very well. And I think the whole sort of moving around and doing shifts is slightly disruptive to that. But if you see someone who inspires you because of the specialty that they do, or because the way they talk to patients, or the way they teach and train, hang on to that person. They will be worth their weight in gold in guiding you in your career. And I'm really privileged in that the first transplant surgeon I worked for as an F1 is now my colleague. That's how it works. Is just find people who inspire you. I think it feels very lonely in the current way of working with shifts, etc. So look out for the people who you want to be like, and try and follow them.
Yet, here you are.
If you are down